Single biggest obstacle to healthcare innovation today?
Inertia.
Sci-fi or reality? Name a sci-fi healthcare idea you think could become reality in the next decade. Please tell me it's tricorders.
I was just going to say that. I actually think that, if we're really drawing from the sci-fi canon, yes, like non-invasive devices that can get a very, very good understanding of your moment-to-moment health.
What are the most important policy trend changes that you think are going to happen? Changes in policy in the next 5 years. Welcome to the latest episode of Resilient Alpha. Today's guest is Alexi Nazem. He's a general partner at AlleyCorp, one of the most active early stage venture capital firms in New York City, where he leads AlleyCorp's portfolio of healthcare investments and incubations. His unique blend of clinical expertise as a Yale-trained internist, entrepreneurial success as the co-founder of Nomad Health, and now as a venture capital leader, Alexi is at the forefront of driving healthcare innovation, tackling the biggest challenges across healthcare technology and services. In this episode, we'll look forward exploring Alexi's bold vision for the future of healthcare and how AlleyCorp is empowering the next generation of entrepreneurs to redefine the industry. We'll discuss emerging trends, the role of technology in reshaping care delivery, and what it takes to build transformative healthcare solutions in a rapidly evolving landscape. Get ready for an insightful conversation about where healthcare is headed and how Alexi and AlleyCorp are helping to shape that future. Alexi, welcome.
Thank you so much, Marty.
Great. So we're going to cover a group of questions, and then we'll do a lightning round following that. Okay, great. So let's talk about physician entrepreneurship. As a physician turned entrepreneur, you're passionate about empowering clinicians to innovate. What unique perspectives do physicians bring to healthcare startups, and how can the industry better support them as entrepreneurs in the future?
It's a great question. I think that, like in any industry, what you really want is to have people who are really at the front lines, experiencing the problem, seeing the opportunities, and hopefully the solutions, to be a core part of crafting those solutions and bringing them to market. And I think that's especially true in healthcare, which is an incredibly complex web of technology, science, regulation, emotion, passion. And so, doctors and other clinicians really sit at the nexus of all of those very, very strong forces. And so they are very, very well equipped to point out the places that could really benefit from some innovation. And that's exactly why I ended up transitioning from medicine to entrepreneurship. After a while, when you're on the front lines practicing delivering care to people, you get a little bit frustrated with seeing all the problems and even coming up with solutions, but not really having the agency to do anything about it. And so, I took the step to jump out and start a company, and did so and ran it for almost a decade. And it was very satisfying to actually, grab a problem and wrestle with it and really try to fix it. And now, as a venture investor, I'm hoping to be able to, encourage more and more physicians to do exactly the same. Physicians and nurses and allied health professionals, really anyone who puts their hands on patients, I think will have a lot to contribute to innovating in healthcare.
I mean, so there's I'm going to go a little off script here, but there's a great reconciliation in healthcare between the care providers and the business of healthcare. My mother was a nurse, my partner's a doctor, mm-hmm. and I would say there's an artisanal aspect mm-hmm. to doing healthcare delivery, right? Most mm-hmm. people are not in it for the business who are the delivery people. They are in it because it gives them great satisfaction. Mm-hmm. They love other people and they love helping their lives. So it'll be interesting if we can kind of, as you progress in this conversation, we can delve into that struggle, right? Yep. I mean, even the resistance to having EHR, electronic healthcare records, et cetera. It's really interesting.
That same motivation to deliver compassionate care is a very good motivation for delivering better systems, because much of the frustration that physicians have is that the system of care that is supposed to support them in delivering care to their patients that's sitting right in front of them often gets in the way. Whether it's from a financial standpoint, operational standpoint, there are so many ways in which, through the best of intentions, but these systems end up throwing up roadblocks. And so tackling those roadblocks is one way in which physicians can innovate and deliver better care, and not for necessarily the financial reward, although often that is linked, but if only to solve a problem that they see all the time, so that they can get better care to their patients and have that very satisfying reward of helping to care for somebody.
Yeah, absolutely. I mean, just looking at it from the back end, it's amazing how it's delivered these days. So, we'll talk about your vision for healthcare's future, but maybe give like a quick intro about AlleyCorp, where it comes from, what it does, and then how you came to be associated with it. And then we can jump into where you see are the pivotal aspects of healthcare today.
Sure. So AlleyCorp is an early stage investment fund based here in New York City. We focus on investing in companies from the moment of inception. So even in the pre-seed stage where it's just an idea and a person, up through about the Series A. At least those are the points of entry for us. We also incubate businesses where instead of an idea and an entrepreneur coming to us, we generate the concept and pull together a founding management team. And the reason that we do both of these things is that everybody in the firm is both an investor and an operator. So like myself, I was the CEO of a startup company for 9 years. I've lived it in the trenches. And so I think that we're all builders at heart. My partners are all the same way. The firm was founded by Kevin Ryan, who is a serial entrepreneur. He was the CEO of DoubleClick back in the early Silicon Alley days, which is why it's called AlleyCorp.
Wow.
And then founded a number of other companies like MongoDB, Gilt Group, Zola, Business Insider. And initially, he started just investing his own capital, both in companies as well as in incubations. And then about 6-7 years ago, formalized this into an actual investment firm with outside capital.
Okay. That's great. I mean, I guess and also as an entrepreneur, he probably has a way to measure, which probably all of you have. Most of you guys have come from entrepreneurship. Mm-hmm. So you measure potential investments in a different way, because I think there's probably a way you measure a deal sponsor, the guy who's coming to you.
Yeah. I mean, I think what's interesting is measure is an interesting word, because at the earliest stages, there's very little to measure in the most objective sense. Really what you're looking at is the quality of the entrepreneur, their fit with the problem that they're trying to solve, the passion that they have, their attitude. Are they the aggressive 0 to 1 builder type? And so all of us having been in those seats, I think have a gut appreciation for what it will take to go through that early entrepreneurial journey. And Kevin, chief among them, understands that, having done it so many times. And so, and of course, we do measure things. We look at the size of the opportunity, the TAM, to the extent that there's traction in the business. We make a lot of our own objective assessments, but at those earliest stages, you're really making a founder bet. And who better to make a founder bet than the founder themselves?
Absolutely, because there's really an instinct to it. And we've looked at so many deals ourselves, and we really measure the people in a different way than most people do, more than the opportunity a lot of the time. You talked about AlleyCorp. Can you talk some more about transformative shifts in healthcare over the next 5 to 10 years? Like, what do you think the great, changes will be, and how AlleyCorp is positioned for that?
Mm-hmm. Yeah. So just to say, AlleyCorp, about 40% of what we invest in is healthcare. So it's a very significant focus for us. We do other things in software and deep technology and things like that. So we're very focused on healthcare. We've got a team of people, not only me, but people like me, other physician entrepreneurs. So it's a very strong bench, and also, as I said, as a result, a very strong focus on healthcare. So in terms of what we're investing in, why we're so excited, why we've built up a big team, why we're dedicating so much capital to this space, is that I think we're really at a transformative moment and an inflection point. The last 15 years since the passage of the Affordable Care Act have been a period of huge influx of capital, talent, regulatory attention, legislative attention, just general consumer attention. I have to say, and I think it's widely agreed, that it's been a relatively disappointing set of outcomes from what we thought we might be able to achieve in these last 15 years. There was a lot of, gauzy predictions about what would happen when we introduced value-based care and marketplaces and, interoperability and EHRs everywhere. And, so the last 15 years has been sort of a mixed picture. The positive side of it is that there has been so much investment in the ground infrastructure of healthcare. 15 years ago, less than 20% of of health records were digitized. Now over 90%, 95% are. There were no sort of common language of sort of user interfaces and technology products in healthcare for digital health. Now there is. There were very early thoughts about business models for these digital health type companies. Now they're very mature. We know what does work, but also what doesn't work. Despite the fact that there haven't been a lot of very large successes from a commercial standpoint, and certainly from a cost containment and quality improvement standpoint, I think we've now laid the groundwork for a very positive decade ahead. And now with a couple of very big macro forces, I think we're in for some pretty interesting changes. Probably the most important of which is the impact of artificial intelligence in healthcare. It's probably the most transformative technology that we've ever seen, certainly in any industry, but in healthcare, which is itself a knowledge-based industry, and artificial intelligence has demonstrated a particularly significant aptitude for knowledge-based work. The possibilities are endless. Everything from eliminating $1 trillion+ worth of administrative waste to actually expanding the capacity of the clinical workforce. So that's I think probably the most important trend. There's a couple of others, but
so let me jump in here because I want to take a step back from AI and go to AI. So let's set the table for what the environment's been like for healthcare the last several years. We've had a lot of exceptions made in the therapeutics market. A lot of SPACs came out. I'm not sure that was 2021 or what, but a lot of SPACs came out. And they didn't have great results, but a lot of them were in the healthcare space. And then a lot of deals have come back looking for more funding. Valuations have changed. It's almost as if this was a period that was made for AI, where AI can just do it better. People that were the predecessors, really, they're not in great shape. So maybe I'm setting that as a stage. We can talk about how AI is just ready for prime time, because it seems to me like, we've had people who've talked about being able to do better diagnostics. You mentioned also healthcare tech. So maybe you can go from there.
Yeah. So, I think the reason that we didn't see a lot of very successful companies in this period is that no company really did anything other than incremental improvements. It was basically, can you do this a little bit better, a little bit faster, a little bit cheaper? And so there wasn't any fundamental value creation. Nothing really changed. It's to borrow the Henry Ford quote, it was the proverbial, faster horse. It wasn't a car. Now I think that we're going to see some cars roll off the line with artificial intelligence, but also things like drugs that actually cure diseases or meaningfully alter the trajectory, the clinical trajectory. Things like GLP-1s literally eliminate obesity and change all sorts of addictive behaviors. The advent of all these cell and gene therapies, like CRISPR-based therapies or CAR T, or they can actually cure diseases. You can literally cure sickle cell anemia now with a CRISPR treatment, and so this is going to usher in a new era of actual, change the curve, change the trajectory, reduce the cost, improve the quality, improve the access. Those are things that are on offer now. Will it happen? We don't know. It'll depend on, who comes up with what ideas and how they're funded, and obviously the regulatory landscape and the receptivity of the general public. But things are, I think, fundamentally different today than they were 15 years ago from both a technology and a science perspective. And so that's why, we at AlleyCorp are so excited about investing over the next decade.
Yeah, super interesting. In terms of scaling all this innovation, because there's just a huge wave that can happen, right? And I don't think there's an issue of acceptance of AI. It's happened, right? Bob Bozeman once told me, he was like Ron Conway's partner. He said, once something is established, you just expect it every time.
Yeah.
Right. So maybe you can talk about how healthcare will scale today versus how it did yesterday.
I generally agree with you that there's broad acceptance of artificial intelligence, but I think in a sensitive area like healthcare, especially your personal healthcare, there are definitely some hurdles still to clear. There was a study that was published in the JAMA Network Open Journal 2 months ago in July that said that showed that people who hear anything about their doctor using AI in any way instantly trust that doctor less.
Wow.
And so I think we'll overcome that. But the point is that it's not like it's just there. It's not just because people are using AI and, ChatGPT and Gemini and all that kind of stuff that they're automatically going to be very ready to adopt that in their clinical needs. And so now on the flip side, Google's this is now data that's a year old, but every day in the United States, 500 million health focused queries are issued on Google search. So people are using technology to engage with their clinical needs. So there's a little bit of a dichotomy there, but it's not necessarily a done deal yet. So people have to be conscious about how they're adopting AI into clinical workflows. Now, that being said, to the question about scaling, I think this actually represents an opportunity, or AI, let's just talk about AI, represents an opportunity to change scaling pathways in healthcare. One thing that is very possible to happen here is that instead of trying to operate through the system, which forces incrementality, which forces you to deal with inertia, which forces you to deal with the frictions of the system as it is, which forces you to deal with all the interests that push and pull, there is a possibility to create an entirely independent parallel healthcare system for certain things, de novo. And that enables massive scaling, because then you're basically you're unencumbered by a lot of the vestiges of the healthcare system as it is today. And as we said, very complex, and say, let's just focus on the first order problem. You're sick, I have a solution, let's go. And then, if you're using something like an artificial intelligence based clinician, gosh, there's no limit to how much care can be delivered, how quickly. And so I think that that's, going to change the math in terms of scaling in healthcare.
Can you give an example of this? I mean, there's all these like for me, there's I guess there's a lot of direct healthcare delivery pharmaceutical companies.
Mm-hmm.
There's all these specialty pharmacy companies that will give you a prescription that's a little bit different than what you get from general. Maybe
I think those are good early signs of this kind of scaling economics that I'm talking about. So from this last era, these last 15 years of digital health and development and innovation, some of the sort of proto winners, they're not quite yet there, but they're almost there, are companies like Hims and Hers and Ro and these direct to consumer businesses, because they cut through some of the red tape of dealing with the traditional healthcare system, and they allow people to get care in the way that they are in a fashion that is very similar to the way that they're used to getting every other service in their lives. Easy, online, instant, cash pay, etc. I think that is a hallmark of the kind of thing that you're going to start seeing people demand more. People who become patients demand more of, and those things scale. Those things actually.
Do you think that there'll be longevity and wellness networks that will self-create or propagate, because all of a sudden information that wasn't available easily now is available, whether it's nutrition or exercise or things?
Yeah, I mean, so first of all, longevity is just an interesting concept. First of all, I think it's just a rebranding of something that we've been trying to do for ever and ever and ever, which is whether it used to be called wellness, and before that it was called primary prevention, and before that it was just called, going to see your doctor.
ESG.
Right? And so it is. I don't think that it's separate and apart, healthcare and medicine, but the ability to engage with that kind of work and that kind of science and that kind of care earlier on in a patient's health journey, I think is absolutely essential to improving the health, of reducing healthcare costs, et cetera. So I do think that those things are going to get a lot of traction. They already are. I mean, people are the explosion in interest of the general public, not just the sort of tech elite who are doing this kind of crazy stuff trying to cheat death, but general people trying to improve their general health, has really taken off in the last few years. I mean, I'm wearing my exercise band and tracking this, and I'm not particularly advanced in this whole area. Some people are really, really focused on it. And so I think that the demand is going to
transfusion.
No, I don't have a blood boy or anything like that. But actually, joking aside, that is a big issue for this so-called longevity movement, is getting away from this sensation of it being snake oil, because there's a tendency to lump together this cheap death, blood transfusion, wackadoodle kind of stuff, and real medicine that we know actually works and is relatively simple, but the hard thing to do is to get people to do it. And so I think that's where the opportunity, really lies. And I would like us to be able to separate longevity from, good health practice from longevity doing kind of fringe type scientific activity, or even scientific might be able to generate.
I want to kind of transition into talking about your investment philosophy, right? Mm-hmm. And because it's interesting that you've got these huge waves of AI, lots of distressed companies that have in passive intellectual property, AI also can open up historical information that nobody had access to and kind of data mine it in a way that's very cohesive, right? And I'll give you a great example is that I guess there's this group called Every Cure, which is a nonprofit here, and they look through off-patent drugs. But one of the aspects of how they use AI is that they get permissions from large pharmaceutical companies that have off-patent drugs, and they search their database of the notes from the healthcare researchers and see what the healthcare researchers suggested were other uses of the drugs, right? Which it's really straightforward. They just boom, they data mine it, the AI aggregates it all and says, this is a possibility, right? So maybe talk about, what's the next big thing and how you evaluate startups. And again, my perspective towards startups is I always look, is this going to be a platform or not? What's the journey? Is this the right person to lead me on this journey, et cetera? So maybe you can talk about, your general investment philosophy as a general practitioner for partner for 40% of AlleyCorp's business in healthcare investment. And then where you see like the big waves are going to be and how we should ride it.
Yeah. So I think from an evaluation framework standpoint, I think you got to start with the problem. Is this a problem worth solving? And there's a lot of ways to answer that question. One for me, especially in healthcare, is this a first order problem or is this a derivative problem? And I don't want to invest in derivative solutions to derivative problems. I want to invest in problems that are solutions to problems that are really, truly fundamental issues of nature, essentially. Derivative problems are things that are like, hey, I'm going to help you navigate this morass of paperwork and rules and regs. Well, those are human created problems that could be just as easily removed as they were created, right? Sure. I mean, maybe not just as easily, but they can be removed. There's nothing fundamental about prior authorization, as an example. It's a huge business. It's right in front of the money. You can make a lot of money. A lot of companies are. But you know what? Stroke of the pen, that goes away. All of a sudden, United Healthcare and Aetna and Medicare, they decide, well, not Medicare, but the commercial carriers decide we're not going to do heavy duty utilization management like you through prior authorization. That business that was generating $1 billion of cash a year goes away. Not interested in investing in that kind of business.
So you're more in a 0 to 1 business.
Well, not necessarily 0 to 1, but something that is solving an actual problem that exists despite our best efforts to solve it, and that creates sustainable value. And so, I think that thinking through the durability of the problem, the size of the problem, whether or not it's worth solving is a great place to start. I think the other important thing, as I mentioned earlier, since we invest at the earliest stages, you're really making a founder bet. So you gotta think, all right, this might be a great problem, but is this person going to be the one who solves it? Can I imagine somebody else dropping somebody else in and them doing it? Because if I can, maybe this is not the best fit. And there's a certain problem founder fit, but then there's also attitude. Like there's this like run through walls energy. And at the end of the day, the most important thing is betting on the jockey.
Absolutely. So what's the duration of your bet? I mean, are you seed, pre-seed? And how long does that go on for you?
Yeah.
Still an exit.
I think unfortunately venture these days is getting longer and longer. But yeah, I mean, we're making bets. We're thinking at least 5 years. It's like so
you're going to be with this jockey for a long
time.
Yeah.
Long time, probably longer. And so you want to believe that they can grow with the problem, grow with the company, change and adapt. And so there is a lot of founder oriented selection here.
Well, we've had a lot of healthcare guys come to us and pitch their businesses. They tend to be older entrepreneurs, a little bit older than you would get with tech, where it's 25-year-olds are saying, I want to do something and put it on the web, right? It's not so straightforward because you've got to get the regulatory and have life experience.
Yeah, I think that's true. And it goes back to the very first question you asked about physician entrepreneurship. I mean, obviously, in order to get actual experience as a physician on the front line, it takes time. I mean, you got to get some gray hairs, 10, 12 plus years of education. I would trade that. Youth for experience for sure.
Sure.
In healthcare. But I think age, the chronology is less important than the attitude. I mean, I think that one of the things that I think is particularly challenging about clinical founders is that medicine, by definition, is a more conservative profession. You don't want to just sort of willy-nilly try things because people's lives are on the line. And so, naturally, healthcare has evolved into a more conservative, change-averse type of profession. And so it is the unusual doctor who can, throw that caution to the wind and say, I'm going to come at this from a 90-degree angle and really do things differently and sort of be willing to touch a few third rails.
Yeah, I think there's a little bit of eccentricity that happens there.
Yeah.
So can we talk a little bit about workforce transformation? I mean, again, we have COVID happened, tremendous changes in how people look towards healthcare staffing. There's a lot of traveling nurses, all of a sudden the salaries went through the roof, et cetera. People are really burnt out. I think a lot of physicians are just going into that retirement age, and there's a big shortage, right? So, I mean, what are we looking at in terms of, workforce transformation? Is it going to be like idiocracy, where there's like a robot that doesn't really answer the question very well, or is it going to be like some great thing in the sky that's going to say, eat your breakfast? Or
Well, I think there are two dimensions of the solution. I spent 9 years thinking about this problem because Nomad is exactly this, is a workforce-oriented company. We marketplace for short-term staffing in healthcare. So I think there are two things that we really need and that are going to be part of the solution. One is that we've just got to have people stop doing stupid stuff. There's just so much stupid things that doctors and nurses and others have to do, and it consumes so much of their time. So if 50% of your time is spent on administrative and other tasks that are really low value, well, that means that we are getting half the productive output of our existing workforce. So if you eliminate that, dumb stuff, you can double the size of our workforce and the impact almost overnight.
This gets back to that whole struggle between the artisanal,
Yeah.
Making you the best at your craft versus filling out a form.
Yeah, exactly. And I think that, so we had this saying at Nomad, we said, let people do that which only people can do and let technology do everything else. And I think the everything else can be like 95+% of stuff. And so I think we can massively increase the capacity of individual clinicians. That's one way to address the workforce shortage. That alone, though, will not address the ballooning gap between supply and demand, supply of clinical talent and demand for clinical services. And so the second part of the solution is putting more capacity online. We're not going to be able to do that by training more nurses and doctors. It's just not going to happen fast. You could add 50% more doctors, more spots in medical school today. First of all, it'll be a decade before that has any impact. That's too late. And second of all, that just won't even be enough. Just to give you a sense, the scale of the rate of growth of demand is so far outstripping the rate of growth of supply. People who are over the age of 65 use 3 times as much healthcare as people under the age of 65. Everyone in the baby boom generation is going to be 65 by 2030. And so every day, 10,000 people are still turning 65. So the rate of expansion of clinical utilization is exploding. It's insane. Meanwhile, there's only been 150% growth of physicians in the last, I think it's 15 years. So there's like literally no way that we can get enough people trained up. So what's the opportunity? That's why I'm so excited about artificial intelligence. I do think that the capacity of clinical artificial intelligence to add to our workforce is very significant. Since ChatGPT came out in November 22, I've been running cases with the various AI, so Claude and ChatGPT and Gemini and all of them. They're really good, just right out of the box, not perfectly trained, not trained for medicine. So the opportunity there is tremendous, and I think that will actually help us fill a lot of the gap. And then
I also think AI demands a smarter user.
Not necessarily.
You could become more disciplined.
Possibly.
Into it, right?
I mean, I actually think it might even be the reverse. I think that, so first of all, AIs are being, there's been a whole bunch of studies, the AIs are more empathetic than doctors. They're rated more so. It's like an individual that doesn't know that they're talking to an AI versus a doctor. They rated the AI as more empathetic. And a lot of that has to do with patience, just the willingness to sit there and talk to you. And then the other thing, of course, is the adaptability, the personalization, where, the way that a doctor should talk to you versus that they should talk to me is different because we're two different people. And a human doctor doesn't have a lot of notes in their register, and AI has an infinite number of notes in their register. So the opportunity to adapt the clinic, the AI clinician to the patient, I think is quite significant, and I think we're going to see the fruits of that in the very near term.
Fantastic, great. So we're going to take a minute, and then we're going to start our lightning round.
Okay.
Great job so far. All right, we're back to the lightning round, and we've got Alexi Nazem here of AlleyCorp. So Alexi, one word that you'd like to use to describe the future of healthcare?
Different.
Okay. What's your dream startup? If you could fund a healthcare startup tomorrow, what problem would it solve?
Getting people to do behavior change, actually do the right things consistently, helping them kind of hack their brains.
Oh, brain hacking. Yeah, I like that. What's one emerging tech you're most excited about for healthcare in 2030?
The ability to use all the what you call data mining to learn new things about all the tremendous amount of data that we already have and learn new insights and therefore new diagnostics.
It's really weird because healthcare has so many data lakes, and it's hard to join them all, right? So it's problematic. Single biggest obstacle to healthcare innovation today?
Inertia.
Sci-fi or reality? Name a sci-fi healthcare idea you think could become reality in the next decade. Please tell me it's tricorters.
I was just going to say that. I actually think that, if we're really drawing from the sci-fi canon, yes, like non-invasive devices that can get a very, very good understanding of your moment-to-moment health.
What are the most important policy trend changes that you think are going to happen? Changes in policy in the next 5 years?
In the United States, I'd say something like ICHRA, which is the ability for individuals to select their own insurance using employer pre-tax dollars. So this will start to drive the employer out of the healthcare insurance market, which I think has been an albatross for healthcare.
So here's my favorite. And since you have been an entrepreneur and I've also been on the receiving end of the VC pitch me a healthcare startup in 30 seconds that you think is extremely relevant. Just to me. Give me your best.
Oh my gosh. Okay. A tool that is the most patient coach of all time uses the latest and almost manipulative artificial intelligence technology to get you to do the things that you should be doing, like the way you eat, the way you exercise, your addictive behaviors, about sleep, everything. Basically not motivating you, but programming you to do better health behaviors.
So it's almost like if you had an artificially intelligent dog that followed you around and said, "Master, don't open the refrigerator."
Even more than that, the trigger is actually just changing the way your brain operates so that you don't even need someone to tell you to not do it because you just didn't even start doing it.
Fantastic. Great. Well, Alexi, thanks so much, ladies and gentlemen. Alexi Nazem. Thank you.
Thank you very much.
Perfect.